Assalamualaikum warahmatullahi wabarakatuh. My name is Nilam Farhana Binti Abd Aziz, and today I will present about my research proposal, which the title is Selecting the Effective Way to Prevent COVID-19 from Spreading Using Fuzzy AHP Method. How COVID-19 started? Based on a study by Pazos, the first cases were discovered in Wuhan, Hubei province, when employees at the Huanan seafood market, which sold seafood, poultry and birds, became ill with mysterious pneumonia, once again linking wild animal markets to SARS, which is Severe Acute Respiratory Syndrome. China notified the World Health Organization for the first time on December 31, 2019, 23 days after the first patient sought medical treatment. COVID-19 in Malaysia. The first coronavirus were confirmed among 3 Chinese nationals who were quarantined at Sungai Buloh Hospital. Measure taken by the Ministry of Health and Government to combat COVID-19 spread was to expand the number of facilities equipped to handle COVID-19 cases. Fuzzy AHP process is a fuzzy logic-based AHP approach. A fuzzy AHP approach is comparable to AHP approach, which simply convert the AHP scale into a fuzzy triangle scale that can be assessed first. Second, problem statement. COVID-19 still increases rapidly each day in Malaysia. Malaysia has followed the guidelines and prevention by the government, but only some of them may be work. Fuzzy AHP method in this study will try to solve the problem. Then, objective of the study. The main objective of the study is to select the effective ways to prevent COVID-19 from spreading using fuzzy AHP method. The other specific objective is to identify the prevention strategies of COVID-19 in Malaysia. Second, to study the function of fuzzy AHP method on selecting the prevention strategies of COVID-19 in Malaysia. Scope of the study. The study will be focused on the prevention strategies of COVID-19 in Malaysia, which will be conducted using fuzzy AHP. The study involves some experts that are active in activity related to COVID-19 as the decision makers. Lastly, significance of the study. The study will be able to provide which prevention methods are effective using fuzzy AHP method. And it also be able to identify the strategies that the Malaysian government conduct to reduce the spreading of COVID-19. And lastly, the study helps to reduce the spreading of COVID-19 in Malaysia. Preventive action in Malaysia. Shah et al. Conducted a study about actions taken by Malaysian government towards COVID-19 outbreak in Malaysia. Malaysia implemented strict screening mechanism at all airports. Malaysia government implemented a movement control order on March 18, 2020. Also, various organizations held fundraising events to give supplies to hospitals primarily. Then, the study by Gana Seguren et al. On COVID-19 in Malaysia was conducted about crucial measures in critical times. The study focuses on 3 main strategies, which is reducing the spread of global illness, delaying the spread of local outbreak, and implementing community mitigation plans. Mat Hamzah et al. Researched assessing the efficiency of Malaysian health system in COVID-19 prevention and treatment response. There are 7 criteria of COVID-19 prevention. First, social or physical. Second, health monitor. Third, unnecessary touching things. Fourth, hygiene. Fifth, immunity or fitness. Sixth, health diet. And lastly, sharing personal items. Previous study using fuzzy AHP method. I had researched a fuzzy AHP approach for supplier selection problems in Jomoto company. This paper shows how fuzzy AHP was used in a Jomoto company to choose the best supplier based on a set of criteria. Prasovic and Prasovic researched applies fuzzy AHP for ranking and selecting alternative In construction project management, this paper proposed a new procedure for determining the weight of criteria and alternative in the fuzzy analytic hierarchy process, with trapezoidal fuzzy numbers. Based on expected values of the fuzzy numbers and their products, in the study by Hoshi, the data on the effective qualifications of teachers in medical science was analyzed using an application of combined fuzzy AHP and fuzzy topsis methods. Using the AHP method, 6 criteria were assigned weight and 3 pyramid indexes were ranked using this weight and fuzzy topsis. Previous study on prevention strategies. The study by Wu et al. Assessed and compared COVID-19 intervention strategies using a varying partial consensus fuzzy collaborative intelligence approach. Their research intends to determine the effectiveness of COVID-19 pandemic prevention strategies. The research by Saman Liu and Kaya evaluated the COVID-19 pandemic intervention strategies with hesitant fuzzy AHP. The method was used to compare COVID-19 nation intervention techniques used by different countries and derive relative relevance scores. Gorui et al. Researched the identification of dominant risk factors involved in spread of COVID-19 using hesitant fuzzy MCDM methodology. Their study's goal was to rank and analyze the risk factors involved in COVID-19's dissemination. First, method of fuzzy AHP. In this study, fuzzy AHP will select effective ways to prevent COVID-19 from spreading. Although fuzzy AHP contains several other strategies, the relative relevance weight for both the criteria and the alternative in this study are estimated using Buckle's approach. Several steps in the technique are as follows. Step 1. The criteria or alternative are compared by decision maker using the linguistic terms indicated in table 3.1 below. The pairwise contribution matrix is illustrated in equation 1 where Dij denotes the K the preference of the decision maker for the I criterion over J criterion expressed as fuzzy triangular numbers. In this situation, that denotes the triangular number demonstration and D12 denotes the first preference of decision maker for the first criterion takes priority over the second, and equals D12 denotes the first preference equal to 2, 3, 4. Step 2. If there are many decision makers, the preferences of each Dij denotes K are average and Dij is determined as in equation 2. Then, step 3, as indicated in equation 3, the pairwise contribution matrix is updated based on average preference. And step 4, Buckle states that the geometric mean of each criterion's fuzzy comparison values is obtained as stated in equation 4. Ri still stands for triangular values in this case. Step 5. By adding the next 3 subtext to equation 5, the fuzzy weight of each criterion may be found. First, find each Ri vector summarization. Second, find the summarization vectors -1 power to make it in ascending order. Remove the fuzzily triangular member. Third, multiply each Ri by this reverse vector to get the fuzzy weight of criterion I, Wi. In step 6, Wi must be defuzzified using the center of area method because they are still fuzzy triangular numbers. Question 6. Lastly, step 7. Mi is not a fuzzy number, nevertheless as it must be normalized using equation 7. Application of fuzzy AHP on COVID-19 prevention strategies. There are 3 alternatives for each criterion. First, social or physical. MCO, avoid crowd places and 1 meter social distancing. Second, health monitor, screening, temperature, quarantine and vaccination. Third, unnecessary touching things. Public objects, eye, nose, mouth, and doorknobs or stair banister. Fourth, hygiene, wearing a mask, hand wash or sanitizer, and cover cough and sneezes. Fifth, immunity or fitness, exercise regularly, get enough sleep and minimize stress. Sixth, healthy diet, drink enough water, avoid junk food and eat healthy food. And last, sharing personal items, phone, toiletries, and stationeries.